My name is Freek Linthorst and I'm co-owner at the Amsterdam Center for Cosmetic Dentistry. Today I'm going to treat a patient with anterior tooth wear and crowding, and before we start orthodontic treatment I'm going to build up her teeth using direct composite. And the system that I'm going to use is ESTELITE ASTERIA by TOKUYAMA Dental. First we did a shade determination, and I did that by placing some composite bulbs onto the tooth. Then I used ESTELITE Universal Flow medium viscosity to do a quick mock-up in the mouth of the patient, according to the digital smile design that was made beforehand. The mock-up was finished using contouring discs and carefully measured to give the patient an idea of the final outcome of the treatment. A putty index was created from the mock-up to guide the layering process that was later carried out. Then rubber dam was applied to optimize the adhesive procedure and to have better control and view during the layering process. Then minimal tooth preparation was carried out. A small bevel was made, and after that the teeth were air braided and etched using phosphoric acid. Bond force 2 was applied according to manufacturer's instructions, and afterwards the layering process could start. First, palatal enamel shells were created into the putty index using transparent enamel. Then a first layer of dentin was created using ESTELITE ASTERIA shade A2B. Every layer of composite was carefully sculpted using delicate instruments and the Tokuyama brush number 24. The brush ensured perfect adaptations to the tooth. Then an artificial halo was created using ESTELITE ASTERIA shade A1B. In between the dentin enamellans and the incisal edge, ESTELITE Color Clear was applied to make sure that the right amount of translucency would be created into the restorations. After creating the artificial halo, a small cutback was carried out using a chamfer burr. This was done to create even more space for some more layering steps. Then, with some small amounts of ESTELITE ASTERIA shade bleach, some dentin effects were created, reaching from the dentin enamellans all the way to the artificial halo. Small amounts of ESTELITE Color Blue and Lavender were mixed and used for the right translucency shade. The handling of ESTELITE ASTERIA is very easy, creamy consistence for precise application and sculpting. And the resin has an ample working time of about 90 seconds, so that the resin can be sculpted and modeled perfectly before curing it. To create the right proximal shapes, the Mylar pull-through technique was used. With that technique, uncured composite is placed onto the Mylar strip and pulled from the buccal to the palatal side. With this technique, the operator has full control over the shape and the volume of the composite that is applied. To finalize the layering process, the WE shade was used. After this layer, the finishing and polishing of the restorations could start. A new rubber dam was placed, using the split dam approach, to have more control and view also over the pink aesthetics. First, with coarse discs, the primary anatomy of the restorations were finished, and with a saw, the interproximal contacts were opened. Later, with a pencil, the line angles were highlighted and adjusted again using polishing discs. And with a paper cone, the right amount of buccal curvature was achieved. The proximal ridges were then smoothened, again with polishing discs, and with diamond burrs, the vertical grooves and horizontal surface texture were created. The surface texture was in some areas emphasized using an Arkansas stone. And using brownies and an occlu brush, the achieved surface texture was polished. Thanks to the spherical filler technology, finishing and polishing ESTELITE ASTERIA is quick and easy. Finally, a natural result was achieved with a high gloss finish and seamless integration with the surrounding teeth, preparing her for orthodontic treatment as the final step to achieving her beautiful smile.